What are the current medical standard treatment for neuropathy? Some medical cares for neuropathy treatments such as gabapentin or Lyrica or Cymbalta. Some would prescribe opioid medications like narcotic medications such as oxycodone or tramadol. Some would prescribe tensionus. Some would do capsaicin cream. Some would do acupuncture. The problem with all of these standard medical care is that these only addresses the symptom, control the pain, block your pain message signal to your brain, and some of these have unwanted side effects. We have no idea what are the long-term effects of the medication gabapentin and Lyrica. Gabapentin was introduced in 1993, Lyrica was introduced in 2004. So basically, we have no idea what are these long-term effects of for 50 years or 100 years. Other drugs such as opioid medication are highly addictive and are associated with increased death rate. Standard medical treatment do not address the root cause of nerve damage and do not improve nerve damage. They are simply blocking your pain message signal to your brain, so it's entirely up to you whether you want to fix your neuropathy or ignore the neuropathy by blocking the pain message. Thank you.